This is Metro Week. Our top story: changes are coming to Southern Arizona's mental health care system. We'll talk to those in charge of managing the healthcare providers in the region. Plus, our Journalists Roundtable analyzes the week's news.
I'm Andrea Kelly. The state is making changes to the behavioral health care system in our region. Before we get to what those changes could mean, let's look at how the system works. Here's Arizona Public Media's Gisela Tellis with the basics.
When it comes to funding mental health services in Arizona, the buck starts here. State and federal funding funnel from the state's Division of Behavioral Health Services to regional behavioral health authorities, or RBHAs. Each RBHA serves its region, making sure that children, adolescents, and adults with mental health or substance abuse disorders get the services they need. Community-based organizations bid to become RBHAs every 5 years. If they're chosen, they take charge of coordinating with and paying providers and holding them accountable for providing high-quality services. In Pima County, the nonprofit CPSA, the Community Partnership of Southern Arizona, has served as RBHA since 1995. In that role, CPSA has supported the development of culturally appropriate treatment programs, housing and peer support services, and a crisis response center, among other initiatives. More than 50,000 people in Southern Arizona rely on the services that CPSA helps provide. And statewide, more than 200,000 people are served by the publicly funded behavioral health system and the RBHAs that manage it.
Joining us now from Phoenix is Terry Stevens, the CEO of Simpatico of Arizona. Terry, thanks for joining us.
It's my pleasure.
Now, can you introduce yourself to Southern Arizona? What is Simpatico's experience in mental health care in Arizona?
Simpatico has been what they call a regional behavioral health authority for 8 counties in Arizona for the last 10 years. And I have been the CEO throughout those 10 years. So I've done a lot of behavioral health work in the public domain, working with folks that are in the most vulnerable populations.
And starting later this year, you have won the contract to be the regional behavioral health provider for Southern Arizona and the Tucson area. Walk us through that bidding process, because you did win the bid over the existing company. That's
correct. Over the last year, we worked on a process to find a physical health provider that would work with us, because part of this contract will be integrating physical health to the behavioral health for persons with serious mental illness. We went through that process first with the University of Arizona Health Network, and we became partners and bid this together to create Simpatico Integrated Care. And then there was an RFP released from the state of Arizona, which we had about 3 months to write, and then it took them a couple months to make a decision, and then we have 9 months to implement this contract.
Now, there must be challenges in switching the provider for the behavioral health care in Southern Arizona. Can you walk us through what you expect the transition process to entail?
The transition, the very first thing you do is to try to stabilize and do contracting with all of the providers that currently hold contracts with the current provider. And make sure that all the members who are receiving services will continue to receive the services that they have been receiving currently. And then slowly over time, you implement the changes that you promised through your RFP. So that would be what you would expect. We probably will make very few changes up to about 90 days after the contract goes into effect on October the 1st, 2015. Other than that, we will start to pay medical claims, but they should not see a change with their primary care doc. We will get a list from the state that lists all the primary care docs that our folks are currently seeing, and we'll contract with those to make sure that they continue their care with those doctors.
Long term, what kind of changes are you planning after that first 90 days to the overall system?
Well, we're actually looking at improving the crisis system in Pima County. One of the things we want to do is to make sure that special populations are getting better care. For example, folks that are involved with the judge or the justice systems or jails, looking at creating new programs for that, looking at how we can help the foster care system a little more effectively so that we have fewer kids not making it in foster care and or returning home. So we have a number of new programs that we'll be implementing with that program, as well as some programs for kids and adults with developmental disabilities, and some additional employment programs for persons with a serious mental illness. So there's a number of different programs and some new facilities that we'll be introducing to the Tucson marketplace.
When you were bidding on this contract, what would you say were some of the challenges you expect in becoming the new regional behavioral health manager for this area, or some of the differences from the other 8 regions that you manage?
Well, this is a much more urban community, and so you'll be dealing with volume issues. We also are going to be dealing with a little bit different network. Currently, they have adult networks and children's network. We prefer to manage all the providers individually and allow more choice throughout the community. So the community should see, and the members should feel and see better choice, but that'll be a little bit of a change for the providers who have been used to doing this way of doing business for a while. We think it's the right answer, but it will be a transition and a little bumpy in the beginning.
You've touched on this a little bit, but what can the patients expect as this transition continues later in the year?
Well, the big thing will be the choice. That if they want to see a doctor that has currently been in one network and see a case manager that's in another, that they will be allowed to do so and be able to make that choice. Today, if you're assigned to one network, you can only see the providers in that network. And in the future, we will have all the providers that are willing in the Pima County area available to all of the members.
We're hearing that the existing regional behavioral health provider is considering appealing the state's decision to award you the contract instead of the existing provider. What does that mean as you approach the transition? Are you holding off on some of your plans moving forward? How does that affect you?
As long as the procurement office does not, in this appeal process, put a stay on the award, we go full speed ahead. So far, they have not done that and have ruled on the first part of this protest. And the incumbent now has 30 days in which to take it to the next level of appeal if they choose to. So we are currently waiting on that answer, but we are not waiting to do our implementation planning and are busily doing all the planning, working on contracting and all the things necessary to move this contract effectively and smoothly on October 1st, 2015.
Terry Stevens, thanks so much for joining us today.
Oh, you're welcome.
Joining us now in the studio is Neil Cash, the CEO of the Community Partnership of Southern Arizona. Neil, thanks for coming in.
Great to be here, Andrea.
You've had the contract with the state for the past 20 years to be the regional agency that manages behavioral health in Southern Arizona. So let's start with the background. What have you been doing these past 20 years?
You know, Community Partnership of Southern Arizona is a pretty interesting story. It was built by the community about 20 years ago, and community came together to try and figure out how to do a better job of really managing a behavioral health system. We bid on the system in 1995, and it was based on some guiding principles that are as true today as they were 20 years ago, and that has to do with consumer family representation at all levels of our organization. Collaboration, we're incredibly collaborative and have stakeholders throughout the community and the region and even nationally. And then community reinvestment, where we felt like as a nonprofit organization, we owed it to the community to put a lot of money back in, a lot of resources back into the community to support everything that was happening here that related to some of what we were doing. A lot of the activity that we've been doing over the last 20 years has been nationally recognized. So if you look at, for example, consumer family involvement, we were the first to have peers and peer workforce actually trained and working in our provider system. We were the first, we funded Cafe 54. Many of the viewers probably know Cafe 54 downtown, fantastic restaurant. We really value our consumers and our families. We have a lot of partnerships with NAMI and other advocacy groups. So we've been very active in that arena. From a collaboration standpoint, in addition to obviously working with our providers in a collaborative way, we've really reached out and touched major segments of the community. Just one example is really law enforcement. And that's probably the best example I can give right now because, you know, it's such a super partnership in terms of really guiding people with mental illness and substance use disorders, you know, to the right place at the right time for the right kind of services. And that includes, you know, the ability to divert people from jail, to not bring them to emergency departments. And quite honestly, that and many other things that we've done over the last 20 years have been not only recognized by the state, but also nationally recognized.
Okay, and you were partnered in this year when you bid on the state regional behavioral health agency contract. You partnered with United Healthcare. Can you describe what that partnership was going to entail?
Yeah, it was kind of interesting because we've gone through now 4 bid cycles that have each been 5 years, and you know, to give you a little bit of an idea of the stability and how we have evolved as an organization in that 20-year period. There have been 5 regional behavioral health authorities in Maricopa County, and that has created a very fragmented and chaotic system, quite honestly, particularly for the members, for the clients and their families. What happened at the state level is a decision was made that if you are going to apply to be a regional behavioral health authority, you have to have a health plan, an acute care plan, because they were wanting to see an integrated model of integrated services, behavioral health and medical services all combined. And that's a good idea. There's nothing wrong with that idea. So we partnered with United, and they were fantastic. We have a great working relationship with United. We put together a proposal that we thought was just a fantastic proposal. And we're very confident, felt that, you know, that was something that the state would certainly entertain and want to see not only happen in Pima County, but it called for an expansion to the southern region. And so we were very excited about taking what we have done in Pima County, kind of tailoring it to the audience and to the communities throughout the southern region.
Did you get any insight into why Simpatico got the award instead of United and CPSA as a joint?
You know, I can't speculate. I mean, there's a whole lot of things that happen and a whole lot of criteria that get looked at. I can tell you it was extremely close, and you know, I can also tell you that United has filed an appeal. So that is a process that is allowed. It's an administrative process, and at this point in time, that's still active, as far as I know.
Has CPSA joined that appeal?
Yeah, we're part of that group, and we're working with United, and so yeah, we're part of that.
What could it mean if CPSA and United do lose that appeal and you lose the contract? What does that mean for patients?
You know, there'll be another regional behavioral health authority. So after a generation, 20 years, there'll be somebody else coming in and really managing the public behavioral health system. And that's really what that would mean.
Can you explain a little bit what the patient impact could be during the transition, what that will look like for patients?
You know, I can't really speculate on that. We have about 35,000 people in continuous care, and in addition to that, we're also providing crisis services to the whole county. And so that's sort of an open door. It's kind of the front door. We're really able to kind of control some of the traffic and, you know, kind of get people to the right place at the right time, you know, mediate the crisis and then get them back into the community. As far as the transition goes, I couldn't speculate on what that might look like. I know that over the next 8 or 9 months that we have this contract, the things we're going to be most concerned about are patient care. So we're certainly going to continue to do a very quality job with our members and make sure that they get the care that they need. We're going to work very closely with our providers and make sure that they have every opportunity moving forward with this next company, should they be awarded the REBA. We're also going to be concerned about our staff. We're going to obviously have to downsize our staff, and we want to make sure that they land in a good place. And then the fourth area is the things that I've talked about already. We want to stay very active in this community. We feel like we're part of this community. We've been part of this community for 20 years, and I think that we've put a lot of effort back into the community, not to mention, you know, $78 million that we have put back into this community in monies that we could have kept for profit. And that was part of our mission. That's kind of what we wanted to do.
So we don't know how the appeal will go, but what's sort of the timeline for that administrative process?
You know, it's hard to speculate. There's another filing that's due, I think, this month, and then, you know, it's up to the head of the Department of Administration, and then ultimately, if they move it to a hearing, it's an administrative law judge. But that's, you know, it's all speculative right now in terms of where that's going to be going. But we're focused on now, and we're also focusing on what we want to be doing in the future. So Community Partners, Inc., which is the parent company of CPSA, we also own housing. We have some employment initiatives. We have a licensed outpatient care coordination facility. We have properties. And, you know, our staff have been incredible. They really are starting to focus now on where do we go? Where do we move forward? And how can we continue to be significant in this community in any way, shape, or form?
So there is, it sounds like, still a role for some of the services CPSA provides even without being the regional behavioral
those are
health.
things that we're exploring, and obviously our board of directors are going to need to make that final decision. But clearly we believe that what we have to offer in this community, what we've been doing and what we could reinvent ourselves and continue to do could be very significant for this community. And so I think that it's important for us to put that out to our board and to the community, and really to leave it with them to make that decision.
Neil Cash, thank you so much for joining us today.
Thanks, Andrea. It's been a pleasure.
Now our Journalist Roundtable. Joining me in the studio is my colleague Gisela Tellis of Arizona Public Media, plus Dylan Smith of the Tucson Sentinel, and Stephanie Innes of the Arizona Daily Star. Thank you all for joining us today. Gisela, let's start with a little more detail on our topic of the day, these REBAs, these Regional Behavioral Health Authorities. Give us a little more detail on how they work.
So the REBA system has been in place since 1992, and as we saw in the primer at the start of the show, the idea is that they work at the community level, making sure that providers are paid and monitoring them to make sure that they provide high-quality services. They're obligated to provide certain services. They have to provide case management. They have to provide crisis care, including crisis mobile units. And CPSA, the current REBA in Pima County, has supported a lot of the organizations we sometimes hear about, like La Frontera, Kodak, COPE. Organizations that bid to become REBAs and become REBAs can be for-profits or nonprofits. So in this case, CPSA is a nonprofit. Simpatico is a for-profit company, but either way, they are capped in how much profit they get to keep.
And Stephanie, you've been covering health for the Arizona Daily Star. Is it clear yet what this change could mean for the region?
I don't think I don't think we can say that. I mean, I don't know myself how that's going to change things. I know that CPSA has a very high profile in the community, and I think after events like the January 8th shooting, they especially were very high profile, and they were involved in a lot of community events, and they are involved in a lot of community things, including the National Alliance for Mental Illnesses chapter here. So I think it remains to be seen how Simpatico is going to be involved at a community level.
As Stephanie said, they're very well connected in the community, CPSA is. They also do some things that not all REBAs do, so they've been involved in supporting peer support services, even training peer support specialists. So they've supported a lot of these programs that are a little bit unusual, and it's unclear if you get a new organization in that has maybe not the same ties to the community and not the same vision for how they should work, whether that work would continue.
The REBA, the agency that contracts with the state to do this, they work with other agencies, so it's likely that a lot of those smaller nonprofits, the COPE and all the other ones, will still keep working with the new company that's coming in?
Yes, one of the first steps that a new REBA would have to take would be to contract with all of those providers. So the idea would be that a lot of those agencies would continue to work with the organization. How that would play out, how that relationship would work, and how that would affect those smaller agencies is unclear.
And Stephanie, we mentioned in both of those interviews that there is an appeal process going on right now. What is that process? What's remaining in that process?
Well, so the Department of Administration is the one in charge of that, which includes the procurement office, and that has yet to be figured out. I mean, they haven't made a decision on the appeal, but it's United Healthcare is appealing with CPSA. They're appealing the methodology of the way the contract was awarded, and we don't know how they're going to rule on that. I know there was an issue with the contract in Maricopa County, and it did delay so this contract doesn't take effect until October, as we heard, and it could end up delaying the implementation of that contract if they rule in favor of United and CPSA.
Okay. And Gisela, aside from the appeal, what other questions do we have yet to be answered about this transition process?
Well, we just don't know. We don't know what's going to happen at this point, and so we don't know the outcome of the appeal. We don't know if CPSA loses the appeal and Simpatico steps in, how that would affect all the other providers, how that would affect clients who are receiving services, and then what that would mean for the future of CPSA. because we don't know what they would be doing if they're not doing this.
CPSA is a local nonprofit, but this other company is much larger, bigger. They have operations elsewhere. What do you guys know about how they've worked in other places?
There have been some issues with Simpatico working in Cochise County, but I think a lot of those issues were resolved, and this was several years ago. So it's just unclear how that would affect how things work in Pima County.
And they have still continued to get those contracts and to retain those contracts that they've had. So presumably those issues were worked out.
They do now serve, I think, something like 8 counties in Arizona.
Right, right. Now, Stephanie, I'd like to stay on the topic of healthcare in Tucson, but switch topics to the University of Arizona Medical Center agreement with Banner Health. That agreement was finalized this week. What does that agreement entail?
Okay, well, so it was finalized in the sense that the Arizona Board of Regents gave the go-ahead, and the whole thing is expected to close on February 27th. But this was a huge hurdle. I mean, this had to happen in order for the deal to close. And so Banner, what is happening is Banner is a nonprofit health system based in Phoenix. It's coming into Tucson, and it will be the surviving entity. They call it a merger, but it's the surviving entity. So you can call it what you want. But so you've got the University of Arizona Health Network, which includes 2 hospitals that we're all familiar with, the University of Arizona Medical Center here on the University of Arizona campus, or close to the campus. It's on Campbell University campus is what it's called. And then the South Campus, which is the Keno, used to be called Keno Hospital. Then it also includes a health plan and University Physicians Healthcare, which is a physician practice plan. So it will now own all of those things. And it will also have an affiliation with the UA College of Medicine, but it will not be in charge of the UA College of Medicine. That will remain with the UA, but it will have an affiliation. So.
Okay. And then one of the things I feel like was a little bit surprising this week was the news that Banner plans to build a brand new University of Arizona Medical
that was
Center.
very surprising.
So
yeah.
What does that mean?
So they say they're rebuilding the hospital, which is quite antiquated. Parts of it, I mean, Diamond Children's is very new, and there was a huge expansion. There was a new ER built a few years ago. They're keeping all that. That's all staying, and it's very state-of-the-art. But the other parts of the hospital, you know, where you go in, the lobby, it's kind of run down, and that core is going to be completely rebuilt. And then they've bought some land just west of the hospital to build a new, what we expect will be a tower. And they're not adding patient beds. They expect it to more be a state-of-the-art, very high-tech facility just to keep up with healthcare, and they say this has been long needed. So I think it's good, and I mean, it sounds good, and they say that they are able to do this while still operating the hospital. They've done this in other areas.
Okay. And Dylan, have we heard much about what the benefit is for the University of Arizona? Is this just financially the benefit?
Well, if there needs to be a new hospital here in Tucson, especially with the cuts that are coming from the state. There's really no capacity for the University of Arizona to, take on that sort of debt. They already have a bunch of debt associated with that Banner's going to take over from this. So they, rid themselves of a bit of debt and don't have to face the daunting task of trying to rebuild that place, which is, going to be enormous. There is probably going to be a little bit of a complex relationship that plays out with between Banner and the U of A over how the 2 medical schools are run and how that gets associated with the actual hospital facility. But that's something that'll play out in the long run.
Budget-wise, Stephanie, Dylan's talking about this financial benefit, does that mean Banner will handle all operating costs going forward? Or will they share those, or do we know yet? With
the hospital side, with the UA Health Network side, not with the UA College of Medicine.
Okay.
But they actually they are involved financially because there's an academic enhancement fund, and they have pledged to put $261 million into that. And about $30 million will come out every year to go into the College of Medicine in Tucson and Phoenix solely for the purpose of improving the medical school and keeping them up to date. So in that sense, they are involved financially.
Okay. And Gisela, you've been covering mental health in this area for years. What are the implications on the mental health side of this merger?
So the how it will work service-wise is unclear right now. What we do know is that the Behavioral Health Pavilion is part of the deal and will be transferred over to Banner. But the Crisis Response Center is a different story because CPSA holds the lease for the Crisis Response Center. So what happens with it will be tied to the outcome of, or may be tied to the outcome of what happens with the appeal.
So the mental health pavilion that you're referring to is the construction that happened after the 2006 bond at Keno Hospital, or is that right? Okay.
That's right. And so is the Crisis Response Center, and yet the two are they're held by different people, and the outcomes will be different.
Okay. I want to switch to a Pima County topic. Dylan, right before we walked into this studio, we found out that Pima County Sheriff Dupnick is announcing he's going to resign sometime in this year, sometime in 2015. So generally, what's the process once he does resign?
Well, because Clarence Dupnick, who's been in office since early 1980, because he's more than halfway through his term, the Pima County Board of Supervisors will end up appointing his successor. And he's been subtly pushing for his chief deputy, Chris Nanos, to be appointed after him, and really came right out and just made that statement today, and that was confirmed in a press release from the county that he's backing Nanos to be appointed. And we really don't know the date. He just says that he's going to resign sometime in 2015. So exactly when, we don't know yet.
And he would have been up for re-election, or that seat comes up for election in 2016. So,
yes.
So he's going to leave before that term is over.
And then whoever's appointed will fill the seat through that election.
And then they could run also?
Yes, yeah.
Okay. Any early thoughts on what his legacy could be?
I'm still pondering that. You know, it's certainly not unexpected. Everybody's been waiting for Dupnick to, make this announcement for a couple of years now. And in fact, it was, it seemed likely that he wasn't going to run again before the last election, and he was caught up in a little bit of a political fervor over some statements he made about the Tea Party in the wake of the January 8 shootings, and that kind of got his back up a little bit and made him a little bit mad, and he decided to keep on trying to stay in office, and did. One of the interesting things is that he was actually appointed when he was first came into office to fill the place of the sheriff before him. So we kind of had this process of somebody getting appointed, then elected, and then, in his case, staying in office for a very long time.
In other Pima County news, we heard also today that Pima County plans to open its new courthouse, the one that's been in construction for a few years, on Monday. So anybody who has a court date on Monday will need to go to this new Justice Court and Consolidated Court complex. This had some controversy, though, before it opened, some disagreements with the city of Tucson. Can you tell us a little bit of the background on that?
Well, there was a few years back, the city had sort of tentatively agreed to move Tucson City Court into this new building that Pima County was building to be the new Justice Court, to take the place of the old courthouse, the historic courthouse. But it really ran into a bunch of disagreements about the tenant improvements, what it would actually take to furnish the interior of that space, put in basically walls and doors and lights and things like that. Yeah, exactly. The things you actually need to have a courthouse, So the city got, a little mad about that, and decided that they weren't going to participate in the project. So there's still, a bit of empty space in that building that the county has built. But I guess if you have a traffic ticket next week, in the county, make sure you go to the new place, not the old place, or you're going to end up with a little bit of trouble.
And that's what I was going to ask. People who have an 8 a.m. Monday appointment, how are they going to know where to go? Were they told of this change?
I guess there have been a bunch of, I haven't had a ticket lately, thankfully. I guess there have been signs down at the Pima County Justice Court telling people that they're going to need to go over there. I guess they'll still be hanging up Monday. It's only a couple of blocks to walk if you end up going to the wrong spot.
Okay, so we'll hope that people have time to get there still get to their appointment in court.
Well, the last time I had a ticket and had to go to Justice Court, the lines were pretty long, so.
So you might have a buffer built in.
Yeah, there's a little bit of a time element that's okay there.
In our last 45 seconds or so, we did see that Rio Nuevo finalized an agreement to build the arena site. What does that include?
We keep calling it the arena site. We've been calling it the arena site for more than a decade now, but there's actually not going to be an arena there. There will be a small apartment complex, a small hotel, some museums, and things like that. Okay,
and that also hasn't closed yet, correct?
Right.
Okay, so what's the timeline for developing that site?
The developer needs to sink a bunch of money into it over the next few years or face a pretty severe penalty. So we're not going to see these sort of thing play out like we saw with the Thrifty Block, the Post project, where it's sitting empty even now.
All right, thank you so much. Thank you all for being here this week. That's it for Metro Week. For more on this week's news, including stories that aired on NPR 89.1, go to our website. Now Arizona Week reports on the week's immigration and border security news.